Welcome to another episode of the Embracing Joy podcast. And I'm so excited to introduce our special guest, Dr. Ballenger, today. We're going to have a conversation about balancing success and well-being. So thank you for joining us today, Dr. Ballenger.
Thank you so much for having me, Dr. Majette.
Yeah, it's definitely a pleasure because you have a very unique background in medicine. So I want people to know more about you. So I'm going to go into your bio. And of course, you can add anything that I miss out as far as your bio. Because you're board certified in both internal
Sure.
medicine and pediatrics, which it's kind of unique, and you work with all ages. And you're also a doctor of osteopathic medicine. So you use osteopathic manipulative therapy and treatment to realign muscles, spine, soft tissues, lymphatic systems for different medical issues. You graduated from Nova Southeastern University. She graduated from Nova Southeastern University College of Osteopathic Medicine, and she did her Med Peds residency at the University of Kentucky. So she's unique because not too many people do both internal medicine and pediatrics and have that unique osteopathic training. So it's a pleasure to have you here. You also
Thanks.
love traveling, and you are married and spent 9 months in New Zealand as a hospitalist as well. And she's had a lot of different work experience, including locum tenens and outpatient medicine.
Yeah.
And she's also conversational in sign language. So
Yeah.
that's what I'd like to say. So you've really done a lot, but you're settled now in Olive Branch, Mississippi, and
Mhm.
she's providing service there to patients through direct primary care. So she's
Right.
had a very rounded career and has a lot to offer as far as experience for patients. So if you're listening and you're near Olive Branch, Mississippi, and you're looking for a new primary care physician who has that different experience, then I'm sure she's open to new patients. Yeah,
Yeah,
you can.
we are. Yeah. And with the direct primary care, we don't accept insurance, so people have to be okay with that. We're a membership model. But that allows me not to have a huge patient panel. I don't have to have 5,000 people, as members of the clinic to sustain the clinic. I could have 100 or I could have 500. And it allows me to have as much time as I need with each patient, which is huge.
Great. So let's go
Oh,
into our game, which is our warm up game to get started before we go into the interview. And the game is called Convergence. So you say the first,
okay.
we say it's an improv game. We say the first word that comes to our mind on the count of three. And then we hopefully say the same word eventually. So, for example, if I say kite and you say wind, maybe we both say sky as the next word, but it just happened to be something that relates the two in any type of way.
Okay.
Ready? Okay. All right.
Okay.
One, two, three. Sky is on my mind. What word
Yeah,
did you say?
sky cloud.
You said cloud. Okay. So something that connects
Yeah.
something that connects cloud and sky on the count of three. One, the first word that comes to your mind. One, two, three. Lightning.
Rain.
Rain. Okay, we're very close.
Yeah.
Okay. Rain and
Yeah.
lightning. Ready? Rain and lightning. One, two, three. Storm.
Thunder.
Thunder.
Yeah.
Okay, so I said storm.
Yeah.
So thunder and storm are very close.
They are.
Yeah, we can try one more time. Let's see if we can. Okay, let's see. But we can go broad. It doesn't have to be like very specific. So,
Okay.
just the first word that comes to mind. One, two. Well, one, two, three. Night.
Weather.
Oh, weather is a good one. Yeah, weather. Okay, I had night. So
Yeah.
night and weather. One, two, three. Cold,
Sleep.
Sleep. Oh, that's a good one.
Did
Uh-huh.
you sleep at night?
Sleep. Yeah, because you sleep at night. Yeah. So sleep and cold. You have, okay, 1, 2, 3. Hibernate came to my mind.
Blanket.
Blanket.
It's very
Okay,
similar. I
yeah,
like to
they are.
hibernate under the blankets for sure.
Okay. Yeah, definitely, definitely. So let's do this one more time, and that'll be the end of this warm up. It was a nice warm up to
Okay.
get our muscles. So hibernate and
Okay.
blanket, and we can't repeat words.
Okay.
Um, okay. Mm, okay. 1, 2, 3.
Dream.
Comfort. Oh, that's nice. Yeah.
Yeah.
I think we'll end it at that. Yeah, definitely. So dreaming and we're comfortable in the night, and
With a
there's a
nice
storm.
thunderstorm outside. Yeah.
Nice thunderstorm outside. That's a nice visualization that we have.
Yeah.
Um,
Relaxing.
Very relaxing. So, Dr. Ballinger, we went over your career and it's very diverse what you've done in medicine, and especially now that you have your own practice. How do you maintain your joy and well-being while balancing the high demands of your profession? Like, what's some examples of how you have done that?
Well, when I was doing locums and traveling all over the place, the type of clinic I worked in was a fee for service clinic. So basically, it's an insurance based model, right? And depending on where you work, you either get paid, because I was locums, I got paid by the hour. But a lot of physicians get paid by RVUs, right? And so you
Mhm.
have to do so many things to get paid and get bonuses and stuff like that. And that is really stressful for a lot of people. And so by opening direct primary care, I get to dictate the payment terms, and so that is nice. I don't have to do tests that are unnecessary just to drive up RVUs, which feels so disingenuine. And
Mhm.
so by cutting that out actually helped bring me some joy. Plus, not having the huge patient panel, I have time to see patients, to sit with them, to get to know who they are as people. And that makes a huge difference. And then when they call on the phone or they email or they text, I know who they are and I know why they're asking. And I have a sense for maybe what kind of treatment they would be okay with versus what they wouldn't, because, some people don't really want to take medications, and that's okay, and we can talk about alternatives. And it's nice to know them well enough to be able to go through that with them and meet them where they are. And that, just to
Mhm.
have the time, that has, and gosh, to have the time to look stuff up, you know what I mean?
Mhm.
Because it's like after
Mhm.
you learn all this stuff, sometimes if you don't see it, you forget it, right? And so it's nice to go back and say, I remember back in med school that one story, let me go, and you actually have time to do that. So that helps a lot. So that's why I shifted, and how I find this to be much more enjoyable and much less burnout causing,
Mhm.
um, is that I get to know my people,
Mhm.
you know. So that's
Yeah.
nice.
Mhm. So you really the having that relationship and spending more time with patients is something that really brings you joy because you have time to do it now in this model of practice is what I'm hearing.
Yeah, and you know what? They have time too to flesh out other things that are bothering them, because I think a lot of people think, well, medicine is, I'm sick, I need a drug, let me go in. But it's also, what other stressors do you have in your life? Is your relationship with your spouse going well? Is your relationship with your children going well? Are you in a stable housing environment? Can you afford your medicines? Like, what else is going on? Is your job secure? That all contributes to stress, which can all contribute to your health for better or for worse. Are you exercising enough? Are you getting enough sleep? Like, we have time to actually talk about all of those things. And
Mhm.
that's huge. Yeah.
Definitely, it's definitely a big change in the way you're able to practice. What's an example of something you did when you were in a fee for service type practice to just, manage your joy day to day or well-being day to day?
Well, because I got to travel when I was doing that, I often would go around to wherever I was and kind of see what that area was known for. So one of the times I was able to work in a place called Depot Bay, Oregon, which is right on the
Mhm.
coast of Oregon. So it was lovely to just go to the coast and do a run along the beach, or, you know, watch the whales. You could see whales up there in the
Mm.
water. That was cool. So, I mean, stuff like that. Unfortunately, sometimes I really like to go out to eat and try restaurants. So that's good and bad, right? so,
Well, we
you
have
know,
to eat.
uh,
We have
but
to.
necessarily have to eat deep fried food, but that's what's
No.
delicious, right? So, but that's another thing that I really like to do is I like to try to replicate what I find other places or to find healthy recipes for people. And then when I find one that's a success, I actually email it to my patients in case they want to try it too.
Oh, that's
Yeah.
cool. Yeah, that's cool. I mean, because, that I think tip is helpful for someone doing locums to just
Yeah, and I'm sorry,
embrace.
I know there's a lag here.
Yeah, I think that tip is very helpful for someone doing locums to embrace each city that they're in for what they're known for and to go and experience and enjoy their time in that area while they're there. So, Dr. Ballenger, you've been involved in several volunteer initiatives. You've done medical mission trips and blood drives. How are those experiences? How do they contribute to your sense of purpose? And how would other professionals
Mm-hmm.
incorporate, other acts of service to prevent burnout?
Mm-hmm. And it's hard when you do locums too because you're by yourself a lot of the time. You don't know the people there, and they have their own families and their lives to attend to, right? So it's hard sometimes to make connections. And when I was doing it, my husband was getting his master's, so he was stationary somewhere while I was traveling. And so that made it a little bit difficult. But, you know, going out, like I said, to the ocean, listening to the waves, stuff like that, it's great. I also like to knit and crochet, so I spent a lot of time.
So you've been involved in different volunteer initiatives, including medical mission trips
Mm-hmm.
and blood drives. How do they contribute to your sense of purpose? And how would other professionals incorporate similar acts of service into their lives?
Well, I think I did hear that. Thanks. So I got the blood mobile to come up here frequently because where we are, at least in Mississippi, we always have a deficit of blood supplies, blood products to use. So trying to get the blood mobile to come up here every couple of months, it feels good when they get, several units that they can use for whatever they need it for, right? And it just helps the community. So that feels good. The medical mission trips, I did those when I was in med school, and just finding people that go and do that is helpful. There are other direct primary care doctors that do the medical mission trips as well.
So, as a business owner and physician, what
Mhm.
strategies do you use to foster a work environment that promotes both professional success and personal well being for yourself and your team?
So I am my team. It's just me. So that helps. I don't have to have any type of inner office drama, right? I mean, I guess if I have a dramatic event, I just have to talk to myself to calm myself down, right? But
Mhm.
that's kind of nice. I don't have to deal with a ton of personalities necessarily that might be detrimental to the office environment. I currently do sublet a room to a massage therapist who's running her own business out of our office, out of our clinic. And she's amazing. She's a wonderful person to share the space with. And so it's nice to have somebody around that's just a lovely person with a good aura, I guess you can say, right? She's just a wonderful
Mhm.
lady. So that has actually been really helpful. I think might be nice to grow to a point where I need to hire people, but also I'm not sure I want to manage that. I really just want to see people and deal with them and their medical issues, right? So I don't know. We might head in that direction. So I
Mhm.
think not having to deal with that, to be honest, has been joyful. So, but it's nice to be able to control my schedule. It's nice if I have to take time. Like, for instance, I just finished my DOT training, so I'm going to be taking the test for that this week. I was able to schedule that without a problem. I don't have to ask anyone permission to take the time to go do that test. I don't have to I don't have to clear it with anybody. I mean, it's wonderful.
Mhm. Yeah,
Yeah.
having autonomy in your schedule, I'm sure can help with a lot of things. So,
That's right.
yeah. So, with that being said, we're gonna do our wrap up questions, which are
Okay.
like, who is a model for joy in your life and why?
That's a good question.
Mhm.
I think I don't know that I have any direct family members. I mean, I have happy people in my family, surely, but I think the most joyful two people I can think of off the top of my head or Bob Ross, right, with his happy little trees. And I mean, if you're feeling bad, you just watch him and paint along with him, right? You're going to feel better. And he always talks about how if you make a mistake, it's not really, it's a happy accident, right? And it's just going to make the picture even better. That's a nice philosophy to live by. And I do personally look at mistakes as a learning experience. That's what we need to do to further on and learn, right? And then Robin Williams has always brought me a lot of joy. And I know that his joy was a facade for his depression, but he's just was so wonderful. So, I mean, I think those guys, but Bob Ross, I think, is the epitome of joy.
Yeah, those are great examples. I personally never watched Bob Ross, so I'm not sure, but I've heard of him and I've seen like, short clips of him, and yes, definitely joyful, but I love Robin
Oh yeah,
Williams. I really
he's passed
enjoyed.
away now, but he was great.
Yeah, he was great.
Me too.
So, if you were cooking a cake of joy, what would your top 3 ingredients be? For as far as metaphorical cake of
Chocolate for sure. Oh,
mm.
probably still chocolate.
Chocolate does
And
bring joy.
yarn because I like the project. It
Mhm.
does. And it does cause a release of serotonin, so it medically causes joy. I'm just saying, right?
Mhm.
So, and then I actually do feel the best when I exercise. So exercise brings me joy. But I would add a
Mhm.
fourth layer, and that is hanging out with my husband. He also brings me joy.
Joy,
He would be
okay.
the top layer. Yeah.
Okay. The covering of it, the icing or the top layer.
Yeah. Yeah.
Okay. Great. So this was a great conversation, and how can our audience best reach you if they wanted to learn more about DPC practice, or if they're a physician who wanted to learn more about DPC practice, which is direct primary care practice, or if they're a patient that wanted to learn more about the practice as well, how can the audience find you?
Sure. So we have a website, www.charmeddpc. So, DPC, right? .com. So charmeddpc.com. And then you could email me at drb or drb at charmeddpc.com or call, which our number is on the website. And if you text the number, it gets to me directly. If you call, it goes to my unpaid office manager, who is also my husband.
Yeah. Okay. Well, it's such a
And
pleasure
then if
having.
there's
Oh,
people that aren't in the Olive Branch, Mississippi,
no, go ahead. Go ahead.
oh, I was going to say, if there are people that aren't in the Olive Branch, Mississippi area, there are several online mappers like DPC Frontier and things like that where you can find somebody that's in your area. But if you Google your area and direct primary care, you'll find a person there. I would encourage everyone to look for physician led direct primary cares. You know, obviously, I support physicians. There are some that are nurse practitioner run, and if that's what you're looking for, you can find it as well.
Mhm. Mhm. Okay. Great. Well, this was such a great conversation, and it's definitely a different model of practice that, than traditional, like what we're used to.
Yeah.
But you're able to spend more time with patients, and of course, that's brought you more joy. And I'm
Mm-hmm.
sure the patients who want more of a relationship with their doctor, where they can spend more time in the office visits, maybe an hour versus the 20-minute visit, or have more availability with their doctor. Sometimes direct primary care is a solution to that because you have direct access to the doctor. You're not going through the insurance company or a huge office system. You're going straight directly to the doctor. So that's
Right.
a different model. Mhm.
Mm-hmm. Which is nice. You don't have somebody like filtering your messages either.
Mhm. Mhm. Okay. Well, great. Thank you for this
Yeah.
conversation. And please, if you enjoyed this conversation, please make sure that you like and subscribe to the channel. Share this video with a friend. You can check us out. We're also on Spotify if you want to listen to this audio at a later time, and or check out our other videos and continue to embrace joy in your daily life and take care. Bye bye.